This is all indicating me to come to this left side and investigate a little bit more. And then when I bring it up, it stays short. Nice. Good. Take a nice deep breath here. Good. Beautiful. Take one nice deep breath. Wonderful. What's up, everybody? This is Dr. Brendan Collinsbride, and I am over here at the Source Chiropractic with Savannah, who's coming in with complaining of some left side pain after going on a walk this weekend. Talking about some sciatica, but let's figure out what's going on. First thing I want to check out is kind of the overall motion of her body. First thing we like to check out here is potentially any discrepancies in her leg length. Looking like the left leg is a bit short over here. If you want to come by and see what this is looking like, I'd love to show you. So as we can see, that left leg is short. And then when I bring it up, it stays short. So this is technically maybe indicating some left side sacral stuff going on. And now when I check the motion of her pelvis, it is certainly not as smooth on that left side too. So telling me there's some SI joint potential dysfunction here. And when I see the resistance, there's also more resistance on this left leg. So overall, potentially some tension coming on. When I'm feeling her posterior chain, already her left calf, left hamstring are also pretty tight. So this is all indicating me to come to this left side and investigate a little bit more. Now coming to her SI joints, I want to see how those iliums are moving. Iliums actually seem to be moving pretty well. Now to come more specific onto the sacrum. Yep, that sacrum on the left side. Not as good movement when I come onto the right. So this is again telling me this left side needs to be addressed. I want to check her piriformis as well too, as piriformis is a big indicator of potential some sciatica. And again, that left side is a bit hypertonic. I want to see what her musculature is above her ilium and her pelvis too, as the muscles really show me a lot that's going on with the joints and the neurology. And again, this left side, her QL is pretty tight right here. So indicating again, this left side, I'm seeing everything show me to this left sacrum, so I'm gonna go ahead and address her left sacrum. Can you lay down facing me, please? Scoot towards me a little bit more. I want to make sure she's in a nice, comfortable position. Feeling good. Nice. Had some good release there. Let's go face down. I want to recheck that. Beautiful. Yes. Getting some better motion there. Resistance is now equal on both sides. And this is what we want. Much more motion. Muscles are nice and relaxed. And we're going to check the rest of her spine and her system as well, because everything is connected. We want to make sure it stays connected. Noticing a bit dysfunction right around her scapular rib cage, around T8. Good. Take a nice deep breath here. Good. Nice. Noticing one more area here. Good. Let's go face up now. We're now going to check her neck, as the neck is really important as the main area where our brain connects to the rest of our spine and our nervous system. And we all know the brain controls everything in our body, so let's make sure that connection is nice and clear. Nice deep breath in. Connect to the breath. Good. Noticing that C1, that very top bone that connects the brain to our spine. This last one right here. Beautiful. Take one nice deep breath. Wonderful. Well, I hope you enjoyed that. I hope you got some good information out of that and what we can do for you. Again, I'm Dr. Brendan Collinsbart over at the Source Chiropractic in Oakland. Love to come serve you if any of this here kind of resonated with you. If you're experiencing anything that we showed here today, we'd love to take care of you. Thanks, y'all. Peace.